My name is Phyllis Burnett. I'm from the Old Dominion University College of Health Sciences. My discussion today is on the Older Americans Act and the Affordable Care Act. The Older Americans Act. President Lyndon B. Johnson enacted the Older Americans Act into federal legislation in 1965 as a commitment directed toward older Americans in support of their rights and for improved quality of care. This OAA initiative brought to light the current daily issues plaguing the older population in regards to nutrition, transportation, and long-term care. The OAA established the Administration on Aging to spearhead and oversee program implementation. OAA services continue to be needed and have increased as the baby boomer generation enters retirement. The need for traditional aging network services such as home-delivered meals, health screening and promotion, information and assistance, and case management is greater than ever, as states indicate that efforts to cut back on Medicaid will continue, resulting in more intense pressure on aging network programs. As the OAA moves into the future, hopefully the services that have hallmarked the program will continue for those who need it the most, older Americans. Furthermore, as the programs and policies have continued to be revised and adopted, the current services available today include nutritional services, which includes group dining and Meals on Wheels home delivery, provisional services like transportation, in-home personal care, adult daycare information and referral, preventative health. This is like elder rights services, long-term care, the Ombudsman Program, and the National Family Caregiver Support Program. Finally, the Elder Care Locator is the point of reference for an older American family member or healthcare professional in need of OAA services. The Affordable Care Act. The fall of 2008 marked a new era for the country with the election of our 44th President, Barack Obama. Upon inauguration, Barack Obama became the first African American to be elected President of the United States. With this mile marker in history, another mile marker was created. Federal health care reform legislation directed at drastically reducing the number of uninsured Americans. In 2010, the Patient Protection and Affordable Health Care Act, the ACA, was signed into law, and from the start, this new health care legislation became known as Obamacare. The ACA is President Obama's signature bill guaranteeing much-needed health care coverage for most Americans. This individual mandate within the ACA requires health care coverage through employer-based insurance, health insurance exchanges, or the optional expansion of state programs, including Medicaid. The newly developed ACA, which came into effect January 1, 2014, is designed to cover American citizens in desperate need of health care. Health insurance exchanges, also referred to as marketplaces, along with 24-hour customer support, were implemented for assistance in ACA enrollment. Enrollment into the marketplace health exchanges through the ACA is performed through the healthcare.gov website. Individual mandates for all U.S. citizens require a minimum insurance coverage standard that meets federal requirements. All uninsured individuals who do not meet the exception requirements were required to purchase coverage through the exchanges during open enrollment by March 31, 2014. For coverage starting April 1, 2014, to avoid a financial penalty. Those not opting into the federal plan must pay a penalty of 1% of household income, which increases to 2.5% of household income by 2016. After initial open enrollment, the uninsured must wait until October 7, 2014 for the next enrollment period. Provisions within the ACA law have some of the key features that are aimed at essential health care benefits, with some special benefits affecting older Americans. These provisions include state exchanges, which allow purchasing of private insurance by those previously uninsured through federal subsidies. Employer mandate to provide insurance to employees. Medicare prescription drug rebates and the eventual closing of the Medicare Part D coverage gap or donut hole. Preventative care services and chronic disease management, allowing older adults more affordability with their medication treatment. Pre-existing coverage denials eliminated. Improving quality care measures through the Medicare Shared Savings Program. Accountable care organizations, or ACOs, are another feature to the ACA design that has been established and are responsible for overseeing all care, cost, and quality of patient care. ACOs are developed through arrangements with hospitals, physicians, and health insurance plans, greatly revamping the old system. Overall, the ACA policy guarantees much-needed coverage to the uninsured, rights as Americans the opportunity for health care insurance. Nevertheless, once the ACA policy and its implications unfold, the country is eager to understand those implications and to decide if this law will truly benefit the country. Only time will tell if Obamacare will have a positive or negative effect on America's healthcare industry, and if the challenge for universal health care becomes a mile marker in history worth remembering. Thank you.